who will do it for you, and you can make an impact. And I was telling her about the system approach to this whole thing. We as an individual, why don't I get involved with healthcare clinics or health fairs and all that? Because that's only those who come. There is a whole group of farmers and laborers left out, and this is for them. So you go to their site, they don't lose a single day of wage.
We can take one question from the floor. Yeah, go ahead.
Because of healthcare, people don't die at 50, 45, 50 or 55. We are living 75 and above. So with that in mind and our population increasing, it's a cruel way to let the older people go first. So could it be done?
No, in this Sevak project, we don't leave anybody out. Everybody over the age of 18 are screened for diabetes. And if they have very high diabetes or that needs treatment, we refer them to primary health clinic. So we don't leave anybody out in there. And they go house to house, by the way. And if somebody has got established diabetes or hypertension, they can go to the Sevak's house any day, anytime. And there is no charge on this whole project.
Thank you so much, Dr. Patel. One last question. Where do they get their training, the Sevaks? Do you have a center? And how long is the training?
We started out 2 months training in the beginning in 2010, but now we have scaled it down to 1 week. And also we assigned the Sevak to another Sevak. So if a Sevak wants to, if a Sevak wants to leave, he gets trained. This weekend actually we are training 10 of them in Baroda, because I've used the Baroda Medical College. You should try to get into partnership with the college, so you have faculty that you can use.
Thank you very much. And then Sunil, you're going to take over. We're running out of time.
So thank you. We're trying to juggle time here before the keynote speaker arrives. So I'm going to quickly ask actually Anju Preet and Dr. Anju Preet to come up, moderator for Dr. VK Raju, speaker. So let's give our full attention to them. Thank you.
Thank you. It's really a delight to have this pleasant weekend for this important topic on seminar on health education. And as Arogya is doing a wonderful work in India, Arogya itself translates to English in absence of disease. But as we go down to the ancient health system, it is not absence of disease that India has always promoted, it is presence of wellness. So that's what we should, we all should be working on, like how to bring about wellness in the community. And that translates to, again, like prevention, what we all are learning about today. And for today's, the next topic is very important on eyes and eyesight. And as we know that eyes are sold to a person, and sight itself is a gateway to the world outside. So to provide sight to anyone, if possible, requires great amount of knowledge and skill, but to provide sight to thousands require a vision. And among us we have a great visionary, Dr. VK Raju, who for over last 35 years has been working in how to provide eye health care to people, not only here in USA, through his Eye Foundation of America, but across the world in different countries, for his passion in preventable eye disease in children. He has traveled to over more than 50 countries, and India being one of those. Indeed, he is going to Vietnam tomorrow, and to be part of this important seminar, he had to change his travel plans. So we are very grateful to Dr. VK Raju for doing that. Thank you very much, sir. And he has facilitated more than 25,000 operations in children, and enabled over 300,000 operations overall. He has trained innumerable ophthalmologists and arranged eye screen for over 100,000 school children. Coming from India, Indian values, he believes that healthcare and dignity of treatment is right of every patient, and he has been trying to contribute in his own ways. Born in Rajamundry in Andhra Pradesh, he has received education in India as well as London. He moved to United States in 1976, and since then he has been working for eye health care, and not stopping there, he started his first eye camp in 1977 in India, and since then he has been visiting India every year and have inspired multiple people, various thousands of people to work in his footstep or serve in their own ways to contribute to his vision. Currently he is a chief
Ophthalmology.
chief of ophthalmology, but the school name is a little like the university.
Monongalia Hospital.
Monongalia, yeah, that's where I stuck. Monongalia Eye Hospital in West Virginia, and he has received multiple awards from not only non-profit organizations but also from professional organizations, and he has established multiple scholarships, endowments to further this cause of improved eye health in children and others. So now I would request Dr. V.K. Raju to further educate us in his vision. Thank you.
Well, I'm very, very glad to be here today. I always feel in the practice I repeat, yesterday is a cancelled check, tomorrow is a promissory note, but today is the cash. You know, when you think of it, and I heard about Ekal for a long time. I was always thinking, how do I connect, how do we connect? But sometimes in our Indian philosophy it is said, synchronous destiny, I think time has to come. But you don't wait for the time, but you keep on, don't use it as an excuse. But I'm very glad that all of you are here, and I'm here today. I was in Iran. I would like to show that little clip of film. 2 years ago I was in Iran actually. It's a marvelous, lot of Iranian philosophy. Well, probably you taught us quite a bit, in India. Yeah. The words came repeatedly when we were talking Thakur Saab and Varmaji and every one of you and Shabji, still we compete. You can't be the last. West Virginia competes with you for the last position. Yet West Virginia is like India in so many ways. West Virginian patients and the families are just like Indian, wonderful. But whatever the political climate, are just laid back and things keep on continuing. So West Virginia, I've been from London, came to West Virginia, never left West Virginia. So I'm a West Virginian, proud hillbilly. And I said, anybody can identify this flower, it's not a decorative flower, so that I can look wonderful or beautiful in front of you. Anyone recognizes this flower?
Lavender?
Crocus flower. Denoting what, or exemplifying prevention of poliomyelitis from on the planet. There are only 2 countries are there. Polio still, few hundred cases, Pakistan and
India.
Afghanistan, India 2 years ago. But though it was like a joke, how could it 3-4 years ago, the 4 countries that had polio were PAIN, that's right. Pakistan, Afghanistan, India and Nigeria. How could I always used to feel whenever I read public health, though I'm an ophthalmologist, In the last 3 years, I have been on public health more and more. I would like to do a degree. When the American Medical Association Foundation gave me, never expected that, International Physician of the Year. Then I thought public health is my real love, and we are going to collaborate with a lot of people. Do you know there's another book called, because this came repeatedly so many times, I'll stand here. So many times, real collaboration. 3-4 years ago, the book came by Rosenberg, probably Thakur Sahab knows it, but with 3 other authors. And Jimmy Carter wrote on the page, real collaboration, what it needs for the global health to succeed, or Indian health to succeed, or West Virginia, or Mississippi health succeed. Anyway, success is small way, bigger and biggest way. It is the collaboration. Jimmy Carter wrote at on the first page, on the cover. Today, we have leadership without cooperation. It is a leadership without cooperation. Then anyway, I would like to bring out those because I repeatedly went into prevention. And the crocus flower denotes the prevention of poliomyelitis from the planet. When they're doing in Italy, the vaccinations, and like in Italy, like in India, they will half-hazard people, in a little sloppy way to do the things. Then they did not know whether these children in this area got the polio vaccine or not. Somebody said, no, we all did it. Other people said, no, we have not done it, even this going on. They took this color, this whatever, they put a little dot on the children so that it is a crocus color, so this became an example for polio, for the Rotary International work for almost like 35 years. And they are getting tired of doing this vaccination, but the only way we can prevent any disease is persistence. Well, my interest is in ophthalmology. I did very little in ophthalmology in India after medical school. I left into India to London, and then when I went back, one of the farmers went on a vacation to a farmer from a village came, sir, I want you to, these are farmers which are family friends for generations. He said, look at my eye. I felt that like a fish out of water. I did not have any instruments and I could not do anything. I thought, why can't we do them? There were so many eye camps in India. There are a lot of wonderful things they have done, but they have done terrible damage too without keeping quality control, without keeping the basic dharma. So many people became blind too. But the concept of eye camp, healthcare outside the hospitals, is a marvelous concept. The health fairs in this country are extension of Indian eye camps. There are a Harvard article on 1980s they have written. They went there and saw how you can give advice, you can screen, incredible things can be done just outside the hospital. Even not many medical people need to be available there, but training like SAVAK and there's so many organizations like that. So that's how I started. 80% of our learning is through vision, and vision is so important for learning. And education is the biggest equalizer. One of the mentor of mine in London used to say, Raj, there are 3 solutions for every problem or any problem. First is education, second is education, third is education. Still, probably they're the best. In spite of education, there are some Sanskrit proverbs, so still people can behave like an animal, but don't take that example. By and large, education. Look at the statistics, WO, I don't want to bore you with the statistics, but still, vision problems, especially in children, is an enormous problem, but incredible things have happened in the last 10, 15, 20 years. But still, the things why children's vision is so important, because if you don't do it in time, the brain cells got neglected, they are blind forever. Whereas if you do it in time, for just sometimes a vitamin A tablet, 5 cents, a 20-minute operation under anesthesia for about $300-400. Another operation for about $500, removing a cataract from child, you can give them 75 years of life. Tell me another example in medicine. So the World Bank once said, combating childhood blindness is the most cost-effective health intervention in the world. Next, most of them, why don't you see so many children with blindness? Half of them, they die because of the reasons they became blind, and connected reasons they die. Next. They called, about 10 years ago, they called avoidable, not the prevention. See, if you go to the average public and all the prevention, you can't do anything with the that's how a lot of people still think. That prevention word doesn't sell in the lay public, a lot of people, it doesn't really. People are very interested here. You all came and sitting here, but most of the people, prevention word, so it's not a very nice word for a lot of people. Combating childhood blindness, they said, what is that? Avoidable blindness, avoid. With the existing 30 years ago, this slide is invalid. Now we have technology and we understand the disease. Combating childhood blindness is identified by the World Bank is almost 11 years ago, the most cost-effective health intervention in the world. There are so many different countries still have problems. India is a highly developed country with the developing country problems. Our children's health is below sub-Saharan Africa, yet we sent a mission to Mars in the first attempt. No country did it. So, highly developed country with developing country problems. Next. And Thakur Sahib said certain things much nicer way. I don't know, any of you read the Wounded Civilization, Dog Cages by V.S. Naipaul? He did it in no nasty way. He attacked the roots and all that. But if you take it seriously, I think it's not just 1 year or 2 years. Within a short time, India can really change because the potential is enormous. India loses almost more than $5 billion. If you can spend a fraction of that, I'm talking about childhood blindness, a fraction of that, we can 90% cure that. Next. This is the first camp we went, all the journalists came and all kinds of things, suspicions and in the newspapers, because this is in 77, I camp. I was also confused and I did not know what to do, but probably intuition. I think I still believe in intuition, so you continue. And there were enemies, but there are good friends too. You follow the good friends, things can continue. Next. And it's a cataract. I'll go and show you that these are those days, if you don't do anything, he's blind forever for another 75 years because primary health care and so many things India since independence. Incredible, they did it too. When a lot of advancement, we can't keep on thinking what we have done. What is not done, if you look at it, I think that is the progress. Next. These are kids next. And this should have been done, like malnutrition can cause cataracts. Aging, most common, I'm sure some of you might have had cataract surgery here. If we live long enough, every one of us will get grey hair, cataracts. And of course, somebody said they lose hair too, But somebody said people who lose the hair in the front are great thinkers. People lose the hair in the back are great lovers. And the people who are bald in the front as well as back, they think they're great lovers. So, those instruments 30 years ago, the cutting instrument technology, somebody mentioned about engineers. Engineers have contributed the advancements of medicine today, not the truly physicians. Engineering, the basic physics, all made such differences truly, and they can do even more, as Thakur Sahib was saying. This instrument just came. We had a problem in Mumbai. I was almost like a criminal. 6 hours it was, I was kept because, what are you bringing? This is in 78. Last in July, I took 2 lasers, small portable lasers, And in Mumbai airport, what are these? These lasers for children's diseases, premature babies, we can do that. Thank you for coming, sir. And they let it go, they did not even open. So incredible changes did happen in India. But for the little small little babies, they can be done very safely today compared to those days with the anesthesia. Next. Next, there is an accessibility. The same kid now, this kid lives in California. You know, we did the cataract surgery many years ago. He's an engineer. Next. That's how I told about that one. Right? I am ahead of my slides. Right? Yeah. And you can do with a 25-minute operation, you can make the eye straight. But that's not the one important actually. These children, this child is about 10 or 11 years old, but the eye that is turning in, the left eye, already became lazy. Now, we did make it straight, at least cosmetically look straight, but we lost the real window. We could have fixed the other eye when she the first 2-3 years of life. What is that needed at the time? Just to close the right eye. So the brain cells start seeing with the left eye, but we have to do it very early in life. So some of the most effective things in health are still simple and cheap. Next. And the corneal problem, they are born with corneal problems, and if they don't have, these people should be reached, like, you know, Sabbath, you have to go because, you know, they don't want the children to be surgeries to be done, but it's changing. It is changing, that kind of thinking. But previously it was difficult to do that. This is a child with a glaucoma, sometimes big eyes and children looking, it may be a beautiful child with the big eyes, but they have problems too. Glaucoma, or the pressure in the eye. Next. And the cataract, that's it. This girl finished college, she's the best in the class, whereas she was struggling at one time in the school. We have to reach these children. They won't come to the hospitals. Next. And this is a little girl, and she came from Mumbai to where I was doing in Vijayawada camp, because at that time these were all, we are talking about almost like 30 plus years ago. That girl now, during the marriage, that was the picture. That is the one which we do it early in life, children's vision, because otherwise brain cells get neglected. Next. And there are a lot of people are involved in this one. You know, as already we are all mentioning, and Ekal is one of the wonderful, I think of the greatest organization with the chapters. If we keep on working with others, that's the most important for us to succeed. So we have a couple of hospitals. The blindness in children not only affects the child, it affects the family, it affects society for a long time. Take cancers, take heart disease, brain tumors. These are all, if something is not done, the children usually they die. But children, you know, with eye problems, if you don't fix, they live forever. My mentor in London used to say, a cardiac surgeon, a neurosurgeon, which are wonderful surgeons, if something goes wrong in the operating room, the patient is 6 feet under the ground. Whereas an eye surgeon does something wrong, or something happens wrong. No, I don't think we never do anything wrong. Something happens wrong, that patient is telling, you did it. And it tells in the town who did it. And if he comes from West Virginia to Maryland, he will tell everybody in Maryland who did the surgery and lost his sight. Next, these are all children still with it. This is a success story of children, what happened. This kid, we brought him from India. At that time, corneal transplant was not done now. I think very advanced, but still, accessibility, affordability is still a big problem. Though wonderful things are happening in India, liver transplants, kidney transplants, and everything, but still, accessibility is still not is unacceptable. Vitamin A deficiency still, as we worked with the Hopkins, Johns Hopkins University, the chairman came to us, and the eye department is very collaborative with our eye foundation. 50% of the children today in India who are eligible, they're all below the age of 5 and 6, who are eligible for that vitamin A 5 cents, still they're not getting. We wrote a couple of papers, we tried to publish in Indian journal, they won't publish it. That's sad, but we all have to work on those we publish in the Western journals. Next. So vitamin E is still a problem. This kid we brought from India, did corneal transplant. Now he finished the PhD in Rutgers, doctorate in Rutgers University. He's the advisory council chairman, but he came at the age, below the age of 2. That is the impact of giving vision to the children. Next. You know, this is a Jimmy Carter's, a little bit connected with the Jimmy Carter's Foundation, and in his library in Georgia, I'm sure Atlanta you might have gone, look at that little child leading the blind man. Next. Headquarters, Carter Center, Merck, WHO, this kind of statue is there, a child leading the blind man in all of those centers. Next. And you know, the human reaching to other and all that, but now I feel we should reach for the children. Next. And Herbert Hoover once said, the children are the most valuable natural resource, not the solar energy, oil and gas. They're also important too. Next. And the only thing new in this world is what we did not learn from history is Truman. Next slide. That says this. During the only civilization that had hospital for sick animals during Ashoka's time in India. There are some books in the Library of Congress in one of the floors. There are more than 4,000 volumes on non-English books, Sanskrit, Pali, other books in the Library of Congress. You have to wear gloves to touch them. This is one of them, translated by a Welsh historian on Ashoka's edicts. Next. India has everything when you think of it. When we struggle, when he showed that to open the toilet, they cut a ribbon. You know, I don't know what we should be doing it, you know, something like that. I think that is the mindset, again, Nani Palkiwala said that is the mindset we have to just get it, or somebody said it's an attitude. Yeah, if they could do that, first attempt, we should do Mars, 1/10 of the cost what the United States did. What is that we can do? Of course, you know, there's a great deal. United States and India are very much alike in many, many ways too. Next. 4 years ago, a child got blind. This is 4, we're talking about, even if it is 1, is too many. A vitamin A deficiency, like a 5 cents vitamin, most of the companies will give it free. He got blind in Mumbai because the cornea melted away. Without vitamin A, there's no defense, and the, you know, vitamin A can cause a lot of problems, stunted growth. It is essential during our childhood. Next. There are 3.3 million NGOs in India, 1 for 400 Indians, many times the number of primary schools and primary health centers. I took the statistics in July in Chennai. I did a Nani Palkiwala memorial lecture on analyzing what Nani Palkiwala said about India, what V.S. Naipaul said it. They said it so different ways, but in a way they said the same thing. One they said, Nani Palkiwala said in an agreeable way about Indians, whereas Nani, he was very cruel, some of you might have seen, but in spite of that you can take the best from it and we can change. Next. This is the book I'm talking about. Next. We need real collaboration, right? We are working with others' works. How do we do that? Next. Well, they always say they need political will, we have need professional. These are all people are saying for what, last 50 years. Next. How? Next. If you think, take mathematics, without mathematics nothing exists. If A is 1, Z is 26. I'm sure some of you know, this is from the internet. I always borrow from somebody else. You know, you don't need to be original, you can keep on learning. Next. A is 1. Z is 26. Hard work.